Introduction to Learning Disabilities by Allison Karpinski. Learning disabilities are neurological conditions that interfere with a person's ability to listen, speak, read, reason, or calculate math. These factors greatly influence their ability to learn and may also include an attention deficit component, a socio-emotional component, or emotional issues. People with learning disabilities can have intelligence of near average, average, or above average, and many do not appear to be different, giving them a hidden handicap. This hidden handicap can go unrecognized from family, teachers, and even doctors, making them unfairly seem lazy or like underachievers. Because of this, they are more susceptible to frustration, anger, depression, and worthlessness, and it is our job as special educators to identify these disabilities in children early so that they can get the appropriate help they need as soon as possible so they don't fall behind. Prior to 1937, there was virtually no recognition of learning disabilities, but in 1937, Samuel Orton, who was a neuropathologist, noticed differences in the interpretation of similar syllables, words, and letters in some children. This is now known as dyslexia. From 1940 to 1960, he and his colleagues in the field explored alternative methods for these students since they struggled to read, but they had little support and most students continued to not receive any additional help and were continued to be put in classes with the educably retarded. In the 1960s, most of the students classified as retarded actually had normal intelligence, but just had deficits in perception and attention. In 1963, Samuel Kirk suggested a change in the name of the label of these students from minimally brain damaged, or MBD, to learning disabled. He also helped form the Association of Children with Learning Disabilities and the International Council for Exceptional Children. By the late 1960s, special education resource rooms began to appear, and B.F. Skinner's research brought about the idea of behavior modification. Classification of subtypes began in the 70s, with the most significant event being the passing of Public Law 94-142, which is the Education of All Handicapped Children Act, passed by Congress in 1975. It requires by law that learning disabled children from ages 3 to 21 receive a free and appropriate public education in the least restrictive environment possible. The focus in the 1980s then shifted to skills development. Special ed and gen ed were also encouraged to join forces at this time, which is known as inclusion. In 1990, PL 94-142 expanded into IDEA, the Individuals with Disabilities Education Act. IDEA identifies who can be helped and who is excluded. Section 504 is a civil rights act that was designed to help the excluded students and requires employers to make reasonable accommodations for people with disabilities. Lastly, in 2007, No Child Left Behind passed to improve testing scores since there was a lack of improvement for nearly 30 years. However, No Child Left Behind does not apply only to students with special needs, but to all students. Some casual factors of learning disabilities include its ability to run in the family. There are also higher chances of learning disabilities if the pregnancy or delivery are difficult or premature, or if prenatal conditions harm the fetus, especially if it is receiving inadequate oxygen and nutrients or use of drugs and alcohol is present. Any postnatal trauma or early childhood exposure to lead, aluminum, arsenic, mercury, or other neurotoxins can cause learning disabilities, especially ADHD. In addition, what happens from birth to age 4 is critical for later learning. The brain literally throws away brain cells that are not being used, so early exposure to learning and socializing is vital. Incidence factors of learning disabilities include how anywhere from 5 to 30% of people are said to have learning disabilities. 5 to 15% of school populations are classified as such as well. It does, however, vary by country and even state, since conditions for identification and classification are different everywhere you go. There is also a 3-to-1 ratio of boys to girls with learning disabilities, and boys are more susceptible to brain damage pre- and postnatally. One indication of a learning disability is a perceptual deficit, and they are very common. They are not caused by deficits in visual or hearing acuity. Glasses and hearing aids may help with these issues, but they do not help people who have perceptual problems. They occur because the brain misinterprets sensory information. 80% of LD students struggle with reading due to deficits in phonological processing, which is the hearing of specific sounds within syllables and words. Teaching children about phonological awareness can benefit both at-risk children and the reading disabled. 3 co-occurring conditions include ADHD, conduct disorder, and Tourette syndrome. ADHD co-occurs with 1 of every 3 special ed students and includes symptoms of acting out of impulse, inability to pay attention or plan ahead, as well as difficulties with sitting still and having an inability to finish a task. Conduct disorder sometimes co-occurs with ADHD and includes having a lack of respect for the rights of others. These students may be cruel to animals, have urges to set fires, intentionally break the rules, and have complete denial towards responsibility for actions. These students may have been abused, neglected, or both, and probably do not receive logical and reasonable consequences for actions, or may have been raised in an environment where the previously mentioned actions are not perceived as unusual, and in some cases are even encouraged. Tourette syndrome, on the other hand, is an inherited disorder that includes involuntarily motor or vocal tics starting in early childhood and which increase during adolescence. They can, however, improve over time. 1 out of 1,000 people are affected by Tourette's, and it is more common in boys. Tics can be as simple as finger tapping to as severe as calling out racial or sexual slurs. Tourette should be labeled as an other health impairment on an IEP and is often accompanied by ADHD and other learning disabilities. There are different programs and services available for students with learning disabilities. Children under 2 years old can be referred to intervention services and specialists through their family doctors or may request an early intervention team to evaluate their child. For children from the ages birth to 3, can resort to state agencies that may devise an individualized family service plan. Children from ages 3 to 5 can also use programs available through early intervention teams. And then at school ages, they can receive special ed services with a regular class setting known as least restrictive environment. With LRE, special educators can assist the child in the room, collaborate with the gen ed teachers, or the child could go to a resource room for a part of the day or be placed in an LD class for all or part of a day. It is the job of the IEP team to determine what services are needed. Home and hospital services are also available, and college are also starting to adapt to the needs of the learning disabled students.